It's 8:45. This is Columbia Morning on News Talk 1400 KFRU, and want to talk with a guest that we've had on several times, but we're going to focus on some research and some of the things that came from a recent conference of several different researchers from across the country and beyond in Chicago, looking at latest in Alzheimer's information. Dr. Joel Shenker has been our expert on that, and he joins us by phone this morning. Good to talk to you, sir. How are you today?
I'm great, David. How are you?
I'm doing well also. Explain what the meeting was in Chicago, though, for those who need an update on, because it's an annual meeting, and what I have fallen into the habit of and know to expect is that when this conference occurs, then you're going to hear a lot of news stories about Alzheimer's and what is the latest on that. So I've kind of expected it, and when I start to see the news stories come out, I know, okay, the conference is underway. What was it?
This is an annual meeting. It's called the Alzheimer Association International Conference. It's a truly international conference. People from all over the world come to it each year. It rotates in different places around the world each year. This year, it was hosted in Chicago, but in other years, it's been in Europe and other parts of the world. And thousands of people attend to discuss the different types of research they're doing on not just Alzheimer's disease, but other diseases that cause dementia, and trying to learn more about what those diseases are and how we can best help.
So do you, when you look at the results of what the research and the updates that you'll see at a conference like this and that come out of a conference like this, what is your overall general sense of advancements that are being made in regard to Alzheimer's Association, its treatment and its prevention? What do you feel is happening?
I think a lot of good movement is happening, and it's really starting to get to a point where we can almost taste the outcomes, almost ready to really start to make such a dent in not just Alzheimer's, but other causes of dementia, that we may be able to realize the dream of the Alzheimer Association of having a world with no Alzheimer's disease. I can see that starting to emerge. I've sometimes quoted this statistic on your show, that if we take all the research papers ever published about Alzheimer's disease and stack them all up on a pile, 50% of all the papers ever published are just in the last 10 years. Mm-hmm. So the amount of research that's being subjected to this huge health problem is burgeoning. It's hugely increasing. And so a lot of this gets discussed at these meetings. And what's important is not just the research that gets presented and discussed there, but the cross-mingling and the interactions and the discussions that different researchers have, blending their different ideas. And what happens is, after a meeting like that, everyone goes back to their research labs, those people who are doing research, charged with new energies and new ideas, and it's that cross-fertilization at these meetings that pays such big dividends.
Joel Shenker is our guest at the University of Missouri Healthcare, a professor there, as well as also practicing with what is it that you focus on? I know neurology, I believe, is the department, but you are more special than that.
I'm what's called a behavioral neurologist. So my area of focus in neurology is on times where brain damage would cause memory loss or other changes in the mind or with thinking, trying to understand and diagnose those diseases. And I spend about half my time seeing patients in our neurology clinic on that topic, and the rest of my time is spent working in the medical school, teaching medical students and running the neurology residency program.
Let's talk about some of the things that might have come out of the conference. First of all, I don't think this was directly out of the conference, but I saw a story in the New York Times. It was a week ago, July 23rd, and it was talking about Eli Lilly wanting to do a study, and they needed to find about 400 people with early Alzheimer's disease for a clinical trial, and they were going to test something that had gone through the early stages of getting approval for the next step. But the gist of the article was that it was hard to find people to be in that trial. And as it pointed out in the article, there are 5.4 million Alzheimer's patients in the United States. And the reporter said, you'd think it would be easy to find 400 participants or 375 participants for a trial like this one, but it's not. Your thought about those stages where they're getting ready to do some testing, a pharmaceutical company, why would it be hard to find people to be in those studies?
You know, there's a lot of complacency about dementia in general. I think our culture is hampered by that. We need to have much more aggressive ideas about what to do and how to respond when a cognitive disorder emerges. And what's happened in a lot of situations is patients, families, really a lot of physicians respond to a patient with cognitive problems by saying, well, gosh, Sam, I'm sorry to hear that. That's too bad. Getting old isn't easy. Good luck. I'll see you in 6 months. And really what you're pointing out is we really shouldn't be complacent. There's a lot that we can do about the fact that cognitive problems are occurring. Some of it's very simple. For example, in the meeting last week, one of the areas of research that was discussed is how even something simple like turning the lights on, keeping the rooms brightly lit throughout the day, can improve patients' sleep, can improve their wakefulness during the day, can improve their problems with agitation, and these are all problems that dementia patients have. There's lots of things, even simple things like that we can do. The study that you're referring to is highlighting the fact that in order to treat this disease medically with medications or other interventions, we really need to do it as soon as possible. If we think about where things like heart disease has gone, we now try and treat heart disease by preventing heart attacks. Obviously, it doesn't do us much good to step in after you've had your heart attack. The best heart attack is the one you never have. We need to have a similar kind of approach to help prevent dementia, or, barring that, intervene as soon as we can. So the few medicines that are approved and we can use help to hold people closer where they're at. But the study that you're citing, and there's several like that, are trying to intervene with medicines that can hopefully slow down the disease and hold on to cognition longer. But if we wait too long, it's too late to do that.
I think one of the other things that's pointed out in addition to all of that is the fact that to get word out that you're in the process of doing research and you need these persons to be a part of the research is a tough one to do. And your rate of finding people who would be appropriate for that study, or for finding those who could be within the right geographical area or within the other right kind of profile that you want, is pretty tough to do for any research, and that's kind of sad because that might hold back some of the advancements that we could expect in some research if there are not enough people that could be matched up in the appropriate research.
That's true. Research is a tough gig.
Yeah.
And one of the things you have to do if you're doing a research study is to be very, very careful that the patients that you recruit into the study are very representative of the disease you think you're studying. The problem is that the world tends to be more gray than black and white. And so the average person, the average patient that's being seen in a doctor's office has a little bit of this disease, a little bit of that disease. Just before you called, I was finishing up a note on a patient I saw recently in my clinic, and my gosh, that poor patient had, I think, at least 4 different reasons to have a dementia. So that kind of patient will not be a good candidate for some of these studies. What they want are clean data. They want subjects that really fit well with the specific disease they think they're studying, so we know for sure what we're dealing with. But there are ways to get involved with that. If you go to the Alzheimer Association web page, you can poke around, and there are links to discover what studies are recruiting, what studies need patients, what the various needs for that might be. There are links so you can go to the researchers and say, I'm available, and they can then do maybe some discussions to see if you're a candidate for a study. And that's something you can do right now, as you go to the web and start to look around.
Well, I like that. That's good. Dr. Shenker is going to be with us for a few more moments. All right, if anybody was paying attention to news last week and the releases or the news items that came out of the Chicago conference from the Alzheimer's researchers, they might have seen something in regard to blood pressure and reducing the risk of dementia. What can you summarize about that would be important for us to hear?
So this is results from a study that actually has been talked about for a couple of years now. These days, these big studies that have lots and lots of patients in them get given fancy names. This is called the Sprint Mind study, Sprint Mind. And what it is, it's a study of many thousands of individuals who are being followed over time. And in particular, what they're trying to find out is what happens if we very aggressively treat blood pressure. So when you go to the doctor and they check your blood pressure, you know there's a a top number and a bottom number. The top number shows how high the blood pressure gets, and the bottom number shows how low the blood pressure gets. And so in this particular study, what they've been looking at is, normally we've been telling people we don't want the top number to get at least to average above 140. And in this study, they said, well, what if we are even more aggressive? What if we say we don't want the top number to be above 120? Now, that's a much more aggressive goal, to treat blood pressure so that it averages no more than 120. But it's already been shown, as the study was ongoing, that when you more aggressively treated the average blood pressure, on average, patients had better outcomes with things like heart disease. And so now the internal medicine doctors and the other doctors that treat blood pressure in patients are starting to change the medicines they use and the goals they have so that the blood pressures are made a little bit lower than we used to do it in the past. The study that you're referring to, the part of this longitudinal study that included cognitive variables, found out that if you look at people who had the lower goals for blood pressure and you followed them over time, they less often develop things like mild cognitive impairment, which is an early stage that can sometimes lead to dementia, or combinations of mild cognitive impairment plus dementia. And so what this study is basically showing is, if we're more aggressive about controlling blood pressure, and not when you're already in dementia, but throughout a person's lifetime, if you're 20, if you're 30, if you're 40, if we're aggressive about keeping that blood pressure under control, this study suggests, it's less likely that as you get older, you're going to develop a disease that will cause cognitive impairment.
Wow. So there's another reason in relationship to blood pressure, not only with the heart, but also with your cognitive ability. So I like that a lot. We're going to run out of time before we get to talk too much more. But another one that I know that people saw the news about, and that had to do with reproductive history of women. And how could you boil that down for us, because it had to do with pregnancy and reproductive history impacting dementia risk for ladies later on in life?
So this is an interesting set of different types of findings in the conference last week. And the take-home message is, boy, this is a hot mess. There's all kinds of different ideas that are now emerging. And I think that the thing I would take from all the different studies in this topic is, this is not a simple issue, and it needs a lot more attention. Many women have struggled with, should they go on hormone replacement after menopause? Or there's also been considerations of, should I have a hysterectomy earlier or should I not? And if I go on hormone replacement, should I do it at this age or at that age? Just to add the complexity, we now know that there are a number of variables that seem to have different amounts of risk for things like dementia. So one study in the meeting showed that women who had 3 children or more in their life had lower risk for developing dementia later in life. People who had miscarriage had higher risk. People who went to their first stage of their first menstrual period, if that was later, if they were as a 16 or a 17-year-old as opposed to 11 or a 12-year-old, people who had later early onset of menstrual periods, they had increased risk. People who had early menopause, who stopped being able to have children, if that happened earlier in life, they had greater risk. So it's kind of all over the place.
Yeah.
And the point I think this makes is, to put a positive spin on it, is you don't have to be afraid of always doing one thing or always doing the other. You don't have to say it's always bad to have pregnancies or it's not, or it's always bad to have early menopause or it's not, or it's always bad to go on hormone therapy or not. I think the positive spin I would give to this is, it frees up women to go and talk with their physicians about balancing the risks and the benefits. This isn't a straightforward thing where it's always good or it's always bad. So if there are benefits to hormone replacement, and women would like to consider those, I think these kinds of findings open up the possibility that might be worth considering, because it's very, very complex.
We're out of time, but this is fascinating. And again, it is an example of how researchers are working so hard to understand Alzheimer's and other types of dementia and looking into so many things. This is a changing field, and we always be kept up to date about it. Dr. Shenker, we look forward to another visit with you soon. Thank you for your time today.
Thanks so much.